I'm Dr. Shibu Vijayan, the Chief Medical Officer of Pure.ai. Welcome to the Curiosity series. I'm in the city of Lusaka in Zambia. Today we have an exciting guest, Dr. Fwasa Singogo. Dr. Fwasa has been working in the health system for last 30 years. He's a medical doctor with public health specialist. In all the 30 years, he worked in different levels of health systems, starting from primary healthcare to the national level, both clinical and program management. For the last 7 years, we have been actually doing some wonderful job as a national coordinator for South African TB and health system strengthening project, where he has been helping government of Zambia in setting up health system strengthening initiative for tuberculosis and occupational lung health diseases. Welcome, Dr. Fwasa.
Thank you very much.
Dr. Fwasa, could you please elaborate on the kind of work you are transforming, you're actually leading the transformative work which you are working with the government of Zambia on health system strengthening? We have been seeing that many disease control programs are being designed in a vertical way to deliver services. But at the end of the day, the primary healthcare is a converging point, and your efforts seems to kind of help and strengthen that. Could you please explain us how have been you doing it and what are the transformative changes you are seeing?
Thank you very much for the opportunity to have a chat with you. Basically, my past years, I've been involved in coordinating the Southern Africa Tuberculosis Health System Support Project. Just from the title, I can see that we're trying to focus on strengthening the existing health systems. However, the unique part of our program then was also bringing to the attention that health concerns or diseases are not just a concern of Ministry of Health, but they involve other ministries that need to play a part. Of course, we will focus on TB as the mainstay, but when we look at occupational health and safety, there is tuberculosis, one of the tribal conditions, as well as silicosis, and that tends to affect the miners who are the most productive unit for our country. So that's how the combination was, and therefore we're working with the Ministry of Mines, Ministry of Labor as well, because they are concerned with the workers' rights and safety and compensation. So that was a combination. So our focus specifically on tuberculosis was how do we strengthen the existing systems right from the primary health care. And therefore we started looking at how do we strengthen, first of all, the community level aspect, because that's where TB patients are coming from. So you cannot just focus at the facility, but look at what's happening at community level. So we had to bring in aspects of community participation through volunteers who would begin to raise awareness, and that would influence behavior change for people to seek services. So we did that part, and we supported those from various aspects like sputum collection, building their capacity to identification and referral. We then supported what we call health center level in terms of building capacity of the staff who are there to be able to identify TB cases as quickly as possible, so that we kind of improve their detection levels. Mind you that this level, they do not have equipment that would assist in terms of diagnosis. And the best they can do is the clinical part, be able to collect sputum, which then they can refer to the nearest diagnostic center. So at that level, in terms of primary healthcare, health facility centers, we did that. When we moved to the district level, now we also had to build the capacity of the staff. There were TB person who would then offer support to the facilities. So we had to build that kind of management support and identification of TB treatment and so on. We also had to include the treatment of drug-resistant TB. So we had to kind of start building a capacity because we wanted to reduce as much as possible the catastrophic costs on net patient. So they had to be managed at the nearest possible level. We did support some facilities, of course, with equipment like Gene Expert. A few we did provide digital X-ray. So a lot of courier system strengthening as well, motorbikes, bicycles, and all that kind of system building. And one of the things that we also didn't do, which is quite important, that we did not, as a program, recruit staff. Not there, right? So we use the existing staff, build their capacity, give them the skills, the knowledge, so that they can be able to provide a better service.
Which is interesting, like you kind of look at the existing staff and upskill them, then give them motorbikes, give the courier services. And if understood the work that you are leading is more upstream with the Ministries of Labor, Ministry of Health, and Ministry of Occupational Health and Mines. And then more downstream, starting from the primary health care center where the patients are coming, been building capacities, and then moving up at the district level, also like focusing on capacity building and transformation, which is a wonderful initiative. Just a clarification, because you have two components in this thing, occupational health and tuberculosis.
Right.
The focus was on mining districts or generic?
We try to focus more on the mining districts. However, some districts that we did support did have mining activities, but they had a higher incidence of TB. So that was one of the criteria of choosing those facilities or districts to support. We picked mostly districts that are along the line of rail, where there's a lot of mining, but also TB and HIV.
If I were to understand it correctly, so the provincial level centers were mostly looking from a standpoint of TB diagnosis, or both silicosis and TB, both were screening?
Well, in the Ministry of Health, the focus basically was TB.
Okay.
Very few doctors or clinicians had that orientation or skill in diagnosing silicosis.
Okay.
So that it was more like a preserve for the doctors working at the Occupational Health and Safety Institute.
Okay.
All right.
Okay.
Yeah, which again we had to change, because if we're going to provide a service at the lower level or primary health care level, we need therefore to build the capacity of doctors who are working at district level. And through this project, what we did was we had the privilege of establishing what we call a set of excellence and the training equipment and kit. So we started bringing in doctors from various districts and being trained in X-ray reading.
Okay, and that was with the focus of silicosis and tuberculosis.
Exactly.
Which is excellent.
So we thought that was the better way to go and to integrate that, but with the view of continuing to build their capacity and provide tools for them, so that as they see questions, they can easily be able to ask, no, this looks more silicosis, can I then refer to the Safety Institute, where they can begin to process or confirm and begin to process issues of the hazards.
So initially, all this decentralized approach was mostly on screening-based approach. The confirmation and compensation will be done at the higher level.
Yes.
Mostly the other tests like pulmonary function test, if required, CT scan. I don't know about how does the guideline followed here.
No, basically for the lung function test, that was done at the institute.
Okay.
Right. They all know ECG, so the CT scan is very rare, which is not mostly used.
Okay.
Right. So Occupational Health and Safety Institute doesn't use that, and it's not part of their guidelines.
Yeah. So you also have been worked in both TB and lung diseases, and X-ray is a key tool to screen and then maybe aid in diagnosis part of it. You also might have witnessed that AI plays a critical role in the TB screening part, and that has been approved by WHO as a critical tool for adults. And in your country itself, there has been early evidence has been generated, which contributed to the WHO guidance, which we should thank or the experts like you for generating that evidence. And now that we all are tasked to actually kind of devise AI tools for screening both the diseases, silicosis as well as tuberculosis, and from a standpoint of cure solutions have been focused on health systems concerned, not looking at one disease. Broadly, when our AI engineers design algorithms from an X-ray, so they focus us on how much, what all findings we could actually help the health system or doctors or healthcare providers in understanding from an AI standpoint. So So that fits well into our integrated health service agenda. And so just want to get your insights on how an AI tool could make, you mentioned about the challenges of like from your earlier stint, you changed the tools to a much more better tools like analog to a digital X-ray. So now that you also see a transformative change when AI comes into, how that helps the doctors both in clinical decision making as well as compensation improving, and also patient better quality of care to the patients.
As a country, yes, we've seen the benefits of using AI in TB. That has been quite helpful, and I think one, it does reduce waiting time, consultation time in the field, because one will be able to have a very definitive kind of suspicion or diagnosis, and then initiate like treatment or investigate in other investigations, and they may need to. However, we've kind of maybe lagged behind in terms of integrating that to Silicosis. Whilst we have also the evidence that you've developed the same tools that use, for example, to detect any the cancer or malignancies in the lungs. So I think we need to quickly move on to integrate issues of silicosis, because I see, as a mining country, Zambia, that we have quite a lot of people that have been exposed. Okay, and therefore it will be very critical or important that the tool developed can quickly be able to pick and differentiate between TB and silicosis, because it reminds me, I had an uncle who died some years ago. He worked in the mines for more than 20 years.
Oh, sorry to hear.
Right? He had been coughing and kept on being triggered with TB, and never got better. Now, when I look back, I said, wow, that should have been silicosis. How come they missed? So it's basically, again, points out to the tools available. Can they support the clinician to make a decision as quickly as possible? And I think developing an integrated tool that will bring on board silicosis to your already existing tools on TB and lung and so on would be very helpful. And it will be more cost effective in my view, that you can use one tool, not kind of vertical tools or standalone tools. That will become quite costly, so that as I can see it being utilized at the facility level, but also as they go out in the outreach facilities, that will be very helpful as well to minimize the cost on the patient as well, but also the cost on it, because cost is not just the money, is also the time. Correct. Paying to make a diagnosis.
Yeah, very true. I think if you look at because there might have been investment from Global Fund also to look for outreach programs for TB. If you're coming up with an integrated solution, then you can actually kind of reap out from that investment itself many diseases, especially in the mining area. If you look at like silicosis, other lung diseases including lung cancer, cardiac diseases, which is all could be flagged in that, which is wonderful to know that. So I know that the current existing funding stream is like tuberculosis. Global Fund is interested in tuberculosis. There is some health system thought process there. Do you see that thought process is being changed, or that discussions are on in country level, or is it can we expect something in the next cycle of Global Fund that is getting realized? Not at scale, but at least from an experiment standpoint.
Well, I think for me it's an opportunity that is there and is more country specific that we need to take advantage of. And as much we're looking at TB, I know we've been looking at TB and HIV, but I think it's time we started looking at TB and other lung diseases, which basically would affect our community. At times we tend to think, oh no, TB, but if you look at the exposure in the community, is quite wide and large, and some of these things we very soon or later will start seeing the effects of it. Look at these stone questions. People are working at artisanal mines and so on. All these need to be. This is a group that needs to be taken care of, and also Global Fund, I think, needs to bring on board such kind of people because we tend to neglect them and think. It's like at times we tend to think unless someone comes to the hospital, then we should become our responsibility. But I think our responsibility starts right at community, and that's why we need to go and start integrating those tools and see how then we can leverage these resources to address also issues of integration of silicosis that confirmation. And I think also as a country we need to start bring on board the issue of AI. You've seen the evidence. The evidence and how it has helped in terms of making the diagnosis. I think for me it's a more cost-effective way to go. It may look expensive at the beginning, but in the long run, to be more cost-effective.
Absolutely. So we also have been interacting with the doctors who are working in the front line, giving care not specifically on one disease, mostly on approaching patient as patient, not as disease-specific silos. And one of the key learning they have been sharing when we provide AI report generally. So our AI report is like we are having abnormal, normal, and then give all the abnormalities listed out, and then give a tuberculosis specific score. And Silicosis product is also aiming to kind of achieve that levels of Silicosis specific score, and then we graduate that to ILO classification later. So one key thing the frontline doctor shared with us was there's a lot of capacity building happening when they are using this tool itself, because they are learning, so they're confident enough to take decisions because they know that there is another report which is helping me in kind of my suspicion is being validated, or either way, because if I miss something it will flag. So over a period of time also the doctor's confidence in chest x-ray reading at the primary healthcare level, I'm just saying the close to the patient level, has been increasing. So have you seen such experience from an AI assisted capacity building standpoint? Have you witnessed that in your country?
Well, we've had a few. I know we've had a project that was running and had the AI integrated to the mobile or digital X-rays. And one of the things that, and just the feedback we used to get from people at a lower level, that it was very helpful in terms of it enabled them to make a decision quickly. And therefore they were able to detect more cases. And also is that it helped them reduce the misdiagnosis.
This is important.
So in terms of as they continue to use, they became more comfortable to use it, and therefore the interpretation and understanding of the results was becoming much better, and therefore it helped both the clinician but also the patient that you treat according to what you've seen, and so misdiagnosis will never be minimized. And which is a cost if one has TB. What should I continue to give amongst the women that and what's the for the antibiotics that we can be very specific and be approachable.
Which is a very valid point. Actually. So most of the time which we talk about kind of like yield more TB cases, but again misdiagnosis is also missed in the sense either you miss it or like falsely kind of classify them as tuberculosis. Both have both. You have witnessed the AI in TB being implemented here. Have you also experienced or anticipating an experience in any challenges coming into that play, both from a regulatory standpoint or adoption standpoint and scaling up?
I think in terms of introduction of AI, I think this is something that is now it's like a burning fire. It's widely being used, not only in the health sector, and I know that the government has adopted that, and there have been a number of meetings on AI and so on, which I think there'll be some coming on. So in terms of adoption, I don't see much of a challenge in terms of the government accepting to or integrate that. However, the issues that tend to come out, which I anticipate, are issues of cost. Can they sustain that once they initiate? Can it be sustained? And therefore, it's something that if it has to be sustained, then it has to be well integrated and planned and budgeted for, so that it's part of the ongoing costs. Rather than where kind of, I think we've already done the contemplate trials,
Yeah.
say,
Yeah.
and we've seen the impact or the effect. And I think we need now to transition into implementation and integration. So that's one area that I see as a challenge. But it can be done in phases, in queue. The government does need to adopt and implement up to the lowest level, but we then continue or start to implement them state by state at a different level. So in that way, then we can be sustained rather than trying to do it right from the lowest level. Most.
Which is a very, very valid point. So you mentioned about how the package is integrated and then kind of like convincing the government to like that funding what as a solution rather than actually going to disease specific thing. And also an approach of phased manner of kind of doing it in facilities where do they have the systems in functioning and then moving on to this next level. So thank you so much, Dr. Fwasa, to actually kind of coming and interacting with us today. So
it's a pleasure and always a pleasure talking to you.
And the wealth of information you kind of like shared with us is very enriching with respect to the knowledge of health system and how countries need to kind of think when they are integrating with AI, how industries like us need to think when they are kind of developing solutions with a lens of more integrated approach. And that is the way that we are forward rather than actually thinking in silos. So really think that was Dr. Fwasa with us and sharing his experience with both occupational lung disease as well as tuberculosis, and pivoting on that health system funding. He shared a lot of actually useful information for technology partners, country health systems, and ministries of health, laymen, and occupational health. Thank you so much.
Thank you.